Okay, so today we're going to be discussing the similarities and the differences between our four instruments that I have here. So in our kit, our universal instrument is the Barnhart 5-6. And then we're going to be using, also demonstrating and explaining the Gracey instruments. So here I have Gracey 1-2, Gracey 11-12, and Gracey 13-14. These are area specific instruments, whereas the universal is obviously universal. So we'll start off by talking about our Gracey 1-2. This is going to be used at a working order of canine to canine on anterior teeth. And we're going to be using the lowest part of the blade to get the correct working angle. In order to properly hold our instrument, we're just going to use our C-shaped grasp. So index and thumb, pad of the fingers on the handle, middle finger on the terminal shank, and our ring finger as a fulcrum. So in order to do this correctly, we're going to be using the side of the toe third on the instrument. The terminal is 1 to 2 millimeters of the side of the toe. So when we angle the instrument, the blade needs to be inserted from a 0 to 40 degree angle. So I'll show you here. We're going to start at the midline, and we're going to maintain parallel within 10 degrees to the long axis of the tooth to ensure the working angle is between 60 and 80 degrees. So we'll start off by the canine. We're going to, again, close it 0 to 40, insert, and then we're going to open and start scaling away surfaces. We would take the instrument out of the interproximal coal space, move on to the next tooth, close, insert, open. Sorry. Close, insert, open. Take it out. Then we're gonna move on. Oh, I should also probably mention, so for the lowest blade, when we move on to toward surfaces, all we have to do is just flip the instrument to use it on the toward surfaces of the tooth. So with all of our instruments, both of them have toes and blades, and they're going to be used subgingivally, but they're also different in a number of ways that you'll be seeing as I kind of show or demonstrate each instrument. So their working order, how to find the right working end, their terminal shanks, and their blades. So the number one difference between our Graceys is that our blades are uneven, and the face of the blade has to be held at a 60 to 70 degree angle, whereas our universal has a leveled blade, and that's going to be used at a 90 degree angle. So if we go to 11-12 for posterior, this is used on posterior teeth. The working order is going to be from the most distal tooth forward, so to the mesial side of the first bicuspid. And with this, we're going to find the correct working order by using V to the D on the terminal shank. So when we're doing that, we have to start at the distal side of the tooth, cover the whole buccal surface or lingual surface, and end in the mesial interproximal coal space. So by doing this, we're gonna close, open, and close, insert, open, and activate a little bit differently as well. We have to, again, make sure we're using our light grasp, not our light grasp, I'm sorry. I'm moving a little too fast. We're gonna make sure we're using moderate to firm pressure against the tooth surface. There you go. And so we'll just close at a 0 to 40 degree angle, insert into the sulcus, and then for this we're going to open it at an angle of 70 degrees. So we always want to make sure that with our Gracies, the face of the blade is parallel with the terminal shank. So the terminal shank is going to be parallel to the long axis of the tooth. So we close 0 to 40, insert, open, and then 70 degrees, and then we're going to start cleaning that surface. Roll all the way into the coal space, and then go to the next tooth. So close, insert, open. Small strokes. And then we would continue doing that all the way to the first bite. With our Gracey 1314, we can either use V to the D or make sure that when we are holding our instrument upright, the terminal shank is not hugging the tooth, it's standing straight. So for this, we're only going to use it on the distal part of the tooth and in the interproximal coal space. So for insert, opening, and activating our Gracey 1314, same thing. We're going to make sure that we're angling it to close from 0 to 40. And then we're going to insert, we would open 70 to 80. Now with the 1314, it's a little bit different. The terminal shank has to be tilted slightly towards the tooth to ensure the working angle of 70 to 80 for enamel and 60 to 70 for cementum. And we're going to use the same working end as our Gracey 1112, which is the most distal tooth. Now for the universal, it's going to be a little bit different because it's all three of our Gracies combined. So for the anterior, we're going to be similar to our Gracey 1-2. It's just for anterior teeth, canine to canine. And in order to ensure we have the right working end on our universal instrument, we're going to do bump to the tooth. And again, we would still start at the mesial surface. We're going to close, insert, open, and make our way all the way into the coal space and pull it out. So for this, it's a little bit, the angulation, we're going to open it so that once it's in the sulcus, the angle of the face of the blade is opened, which is tipped away from the tooth at 60 to 80 degrees. And that's because we have that, we have the leveled out working end. Now, when we are flipping it to do toward surfaces, we just have to flip our instrument to ensure that we have the right working angle, working end. But I'll double check that just in case. We're going to insert, close, insert, open, and rock all the way forward, just like we've been doing, ending in the coal space. Same thing. Close, insert, open. Now for posterior teeth on our universal instrument, it's going to be a little bit different. Same working order as our posterior Gracey's. And similar way of finding out the working end. We're going to make sure that it's not hugging the tooth, just like we did with the Gracey 1314. And close, insert, open, using controlled overlap strokes with a moderate to firm pressure against the tooth. We want to maintain working strokes that are made in a direction away from the soft tissue. Now, the only difference is we don't have to flip over our instrument when we're going to be getting the buccal or lingual surface. We just have to turn it over for our universal. So we clean the distal side of the tooth, and we're going to now clean the buccal surface, ending into the mesial interproximal coal space. So we're going to close this one more time, insert, open, and then we can start our cleaning. So that's really it. As long as the terminal shank is angled slightly towards the tooth at a 60 to 80 degree angle. Nice clean mouth.